Okay.
They surveyed 41 rural hospitals and found that a staggering 75% of them identify Medicare Advantage as their biggest payment challenge.
Wow.
Imagine.
75% is huge. I knew it was a problem, but I had no idea it was that widespread.
Right.
And I guess that when hospitals don't get paid, it creates a domino effect, right? It impacts the care they can provide, the staff they can employ, and ultimately the health of the community.
Exactly. Think of it this way. If you're constantly being nickel and dimed, eventually you're going to have to cut corners somewhere.
Right.
And in this case, those corners are things like essential services, staff training, and even the ability to keep the doors open.
This is starting to sound a bit like a horror movie.
Ah.
And remember, before you even get to this point of choosing between Medicare Advantage and original Medicare, you should be checking out resources like Christopher Westfall's YouTube channel.
He breaks all of this stuff down in a way that even I can understand.
Right. He's a lifesaver for anyone trying to navigate the Medicare maze.
Yeah.
And speaking of resources, the Senior Savings Network is another fantastic option.
Oh, yeah.
They're an unbiased Medicare insurance brokerage that will lay out all of your options and help you find a plan that fits your needs and budget.
Nice.
It's like having a personal guide through the haunted house.
I like that.
Yeah.
Okay, back to our spooky situation. So let's say you're looking at your Medicare options and Medicare Advantage catches your eye with those tempting low monthly premiums.
Right.
What's the catch?
Well, one of the biggest catches is the network restrictions.
Okay.
Unlike original Medicare, where you can see virtually any doctor who accepts Medicare.
Right.
Most Medicare Advantage plans have limited networks.
Okay.
This means you might not be able to see your preferred doctor or specialist, which can be a real problem, especially if you live in a rural area with limited choices.
That makes sense. So if you're someone who values having a wide range of doctors to choose from,
then original Medicare might be the better option. Even if it means paying a bit more each month for a Medicare supplement plan to fill in the coverage gaps.
Right.
Right. And it's not just about the doctors, right?
Exactly.
What about the hospitals?
Yeah.
You already talked about how these low reimbursement rates from some Medicare Advantage plans are hurting rural hospitals.
Exactly. That's a huge consideration, especially if you live in a rural area where a hospital is the lifeline of the community.
Right.
Original Medicare paired with a Medicare supplement tends to have better reimbursement rates for hospitals.
Okay.
Which can mean the difference between a hospital staying open or closing its doors.
So it's not just about your individual health care.
Right.
It's about the health of the entire community. And this is why being informed is so crucial.
Absolutely.
You've got to do your research. And again, Christopher Westfall's YouTube channel is a great place to start.
Absolutely. He's got videos on just about every aspect of Medicare, including a really helpful one that compares Medicare Advantage and original Medicare side by side.